So let's get started. This is Accommodation Conversations Part 1, the impact of COVID on accommodations. So as we go through the session, we have asked you to stay on mute for your microphones, to just stay on mute, to allow us to record the session, to ensure that we can have clarity of presentation and that everyone can hear clearly. We are in so many different environments these days that there is noise and distraction and all kinds of things. And we understand that it also is March break in April in many locations. And so lots of children probably out and about. During this time, if you have any questions, please enter it in the chat box and send it to us. There'll be a Q&A at the end of the presentation where we'll look at the chat box for any questions that might have come up, as well as allow you to, at that point, unmute your microphones and be able to ask some questions. As I said, you should have received the handouts 30 minutes before this session in an email to remind you of the Zoom link, as well as having a download for the handouts. If not, they are in the chat box that you can download those handouts and be able to take some notes. I know that for those of you who have been in the session before with me, I go through information fairly quickly, and so taking some notes is very helpful. If you do hear of some information, you want to get more information about any of the topics that we talk about in the next few sessions, make sure that you check out whether we've got some webinars, toolkits, some additional workshops, and you can go to our online stores for those at gowanhealth.com or gowantraining.com to purchase additional webinars, tools, workshops, and access our resources and make a referral. Or feel free to contact us at gowanhealth@gowanhealth.com with respect to your difficult situations or cases and be able to chat with us about what we can do to help and support you. Coming up, we do have, as with most organizations, all organizations, our workshops have gone online and virtual. We do have access to online workshops, so our cognitive demands analysis certificate program, our mental health and return to work, complex accommodations in the workplace, working from home series, our psychological health and safety in the workplace standards, and our CSA work disability management standards training. All of those are online or virtual. So take a look at gowantraining.com to check out what training we have available that you can do in the comfort of your homes. Now, my name is Nancy Gowan. For those of you who don't know me, I am the founder of Gowan Consulting. Over the past 30 years, I've worked with employers and employees to work together through some of the life's challenges. I am an occupational therapist and a certified disability management professional. I provide speaking and training internationally, and we've also authored a book, Human Resources Guide to Managing Disability in the Workplace, that you can get through Carswell to be able to help with your health and disability management needs. Now, what is Gowan Consulting? Over the past, it's actually 22 years now, in private business, we will offer Canada-wide services as well as some services into the US. As occupational therapists, we're focused on functional ability and work. Our services include ergonomics, accommodation, stay at work, return to work, mental health in the workplace, and training, policy development, and workshops. We work to make the complex simple and work together for your healthy business. So why accommodation? As we start through accommodation, this is data and information that is pre-COVID. It's every year about 10 to 12% of an organization's workforce is off work due to illness and injury. And there can be up to 10 to 20% accommodations being provided, whether informally or formally in the workplace. According to a 2017 Canadian survey on disability, 22% of Canadians 15 years of age or over identify as having a disability. And among the working age Canadians with disabilities, more than 1.5 million or 41% are unemployed or out of the labor market entirely. We have a number of challenges that are happening with loss of jobs during COVID. And we have a lot of individuals that are more vulnerable to be able to remain employed that we want to talk about today. Now, just a quick cost analysis of what does it really cost, though, for lost time. In a typical organization with 2,000 employees, this slide shows some of the potential costs of failure to address early intervention or accommodation in the workplace. So the first line is really the direct line of the cost of benefit, absenteeism. On average in Canada, 9.66 days per employee per year is experienced across the Canadian population. On average, there is employees that maybe make approximately $250 per day. That number may be high for you or it may be low for you, depending on your population. In terms of replacement or overtime, we have to account for then the cost of replacing those employees in the workplace or the overtime to cover that time. I don't know many organizations that have excess of employees to do the extra work. And so generally we're looking at some type of replacement or overtime. That direct cost is 4.8 million for the loss of benefit, as well as 4.8 million for replacement or overtime costs. There are also a number of indirect cost factors that are a bit more difficult to quantify. So what's the cost of administering claims or incidents? And we may be looking at, maybe 200 incidents a year that might cost about $4,000 per incident for 10% of those employees. So about $800,000 in administration costs for the employee, the HR, manager, return to work coordinators. There's also the need to recruit. So some employees do not return to work, and so the recruitment cost could be potentially $10,000 each to recruit, depending on the employee. There's grievances, complaints, loss of sales, productivity. Then there's also the assessment costs, the reorganization of work, return to work program development, modified work time. There's costs of accommodations and the costs of benefits. So overall, if you're an employer with about 2,000 employees, the direct and indirect cost of lost time can be $21.4 million. Now, I don't know many organizations that have a lot of that still left in their coffers to be able to fund. So we want to be able to take a look at how do we retain and recruit individuals with the skill set and the ability to be at work, be productive, and be healthy. Now, you already have a number of employees in your workplace that may not be asking for accommodation. According to the Institute for Work and Health, November 2020, there are different factors where employees are not disclosing a health condition to their employer or a need for accommodation. And why might they not disclose? Well, they maybe are managing the work without others knowing. They may have a health or disability that doesn't affect the ability to do their job. They don't have the right to know as an employer that they need help. And nothing can be done, so there's no point in discussing it. Or there's concern about lost opportunities for promotion or new job tasks, or they don't feel secure in the job. So from the interviews with individuals with episodic or chronic conditions, these accommodations are not necessarily being disclosed or asked for. Now, there's on the other side, employees will disclose where they feel the job is secure and safe, that they accept that having different abilities is part of who they are. They want to make changes to their job and get that support. And they want to let other people know if it does affect their job. And perhaps others, such as coworkers or managers, have asked them if there's a problem or their condition is getting worse and they need to disclose. So we need to understand that some people may not disclose the need for accommodation. They may not disclose that they need that help. So we're going to review just quickly, and in our part 3, we're going to go in detail step by step regarding accommodation responsibilities and steps and processes so that your program is robust. But we want to remind you that as an employer, we have a duty to accommodate. But the duty to accommodate process is actually a tripartite duty. That it is not just the employer that is responsible in that duty to accommodate process, but it also is the union and the employee. So as an employer, you have a duty to accommodate an employee who has a disability, and you want to accommodate them in performing their essential duties up to the point of undue hardship. And we'll talk about undue hardship and all of those things in part 3. But generally, it's looking at health and safety concerns or finances in terms of the accommodation measures that you might take. As an employer, we want to ensure that someone has a reason to accommodate. So our focus is on disability, but it might be in this age of COVID, it might be a reason of family responsibilities. It may be other reasons that the individual, religious reasons that they may ask for accommodation. But we also, as an employer, want to be very aware that if someone is struggling, if their performance is adjusted, their behavior has changed, an employer also has a duty to inquire if that performance change is related to a need for accommodation, whether it be disability, family, or whatever the case may be. So the employer has the duty to accommodate to undue hardship, for reason of disability, and they also have a duty to inquire before they take someone down the performance management route and to potentially terminate. Now, the union also has a duty under this. The union is responsible to participate in the accommodation, to be able to support accommodation that is reasonable for that employee and not block that through either collective agreement wording or other reasons. The employee also has a duty in this process. As we said, many employees do not disclose that they need accommodation. So it's impossible for the employer to accommodate if there isn't that disclosure or that sharing of information. So the employee has a responsibility to share information regarding their accommodation needs. That does not mean diagnosis, medical, all of those things. It's really sharing of information about what they need and that they need accommodation. And actively cooperate in investigating options for accommodations and offering reasonable explanations if they refuse to accept offers of reasonable accommodation. So the employer, the union, and the employee need to work together on accommodations. What are some of those steps? So I've put together just some of the brief steps that it might take when we're looking at accommodation. One, the employee needs to request the accommodation, either written or verbal. The employee shares what accommodation is needed. The employer determines if there is a protected area for accommodation under the code or the law in your jurisdiction. Together, you determine what is reasonable accommodation. There may be a request for a third-party accommodation assessment to be able to determine most reasonable accommodations. Then there's the offer of reasonable accommodation to the employee, and the employee accepting the accommodation or providing reasons why it cannot be accepted. When an accommodation is put together, a written accommodation plan with review dates is developed. You implement the accommodation, evaluate the accommodation, and again, review all long-term accommodations. In Ontario, under AODA employment standards, it says that accommodation plans should be written and reviewed at least annually. But you, of course, would have a good policy, process, and procedure for your accommodation. Again, part 3 will go into the details of how you implement this in your organization. So let's talk about COVID. Last March, our work world changed. With the pandemic, the way that we've done our work, the location of our work, the criteria, infection control, and process for doing our work has all changed. That everything that we thought about in terms of getting together in the workplace, having the tools available in one site, being able to organize your work in a certain way changed. So this too impacted your accommodations. And how? Well, today we're going to talk about the pandemic accommodations. We're going to talk about masks and PPE. We're going to talk about long hauler syndrome and what that is, testing and vaccinations, work from home, and hybrid work models. There's many other accommodations that we'll talk about in part 2, which will focus on mental health and focus on some of those other accommodations, and part 3, how to really put this in place for you. So let's talk about masks and PPE. Well, there's different combinations that have impacted the accommodation request. If you are in a retail setting, in a customer-facing setting, you may have had the requirement to accommodate customers with their request to not mask. You also have probably had employees request accommodations about not masking. And we'll talk a bit about what some of the law has said, what some of the decisions, some of the controversy that has come with masks. And especially when the two collide, when an employee and a customer have different needs. So I'm going to bring forward the Ontario Human Rights Tribunal 2020 case of Sharma versus Toronto. In this situation, the customer had refused to wear the mask. The employee indicated that they wanted that protection, and so was there grounds for accommodation. So when an employee or customer refuses to wear a mask in accordance with bylaws around masking and proper protection and infection control, when they refuse on the ground that they are being discriminated against on a protected ground under the code, the first thing the employer wants to do is consider whether the objection falls within a protected ground. So under the Ontario Human Rights Commission, there's 26 different protected grounds. If the employer determines that the objection does fall within a protected ground, the employer has a duty to accommodate the individual to the point of undue hardship. So where does this happen? Well, the customer who came forward in this situation said they didn't believe that masks were effective, and therefore it was part of their religious and creed belief that masks were ineffective. When the employer looked at this situation, they found that the customer did not, in fact, have a protected ground. So not wearing a mask because I don't believe it works is not a religious protected ground. So creed did not include the not wearing a mask. So under the code, it's unlawful to discriminate based on creed. An individual's objection to wearing a mask will not engage creed within the meaning of the code if the objection is based on the belief that the ability of masks to stop or prevent the spread of COVID is unsubstantiated by scientific evidence. So it is not under creed that you don't believe that science is true. So the next thing is the employee or customer needs to be able to take a look at whether or not they have a disability in requiring accommodation. So when an employer or customer asserts that they have a disability that requires accommodation, an exemption from a mask wearing policy, the employer should not require them to disclose their specific medical diagnosis. Again, reinforces all the principles around accommodation we've always used. We do not disclose diagnosis. We want to accommodate for the functional requirement. In this situation, the customer could not verify that they had a disability. In some cases, an employer or customer seeking human rights accommodation may be required to provide information to verify their need for accommodation. So we need to make sure that your business policy talks about verifying the disability and when you might request that. If they have a disability exempting them from mask wearing policy, the employer must accommodate the individual to the point of undue hardship. And again, undue hardship considers health and safety risks, among other factors. Now, any accommodation from a mask wearing policy must take into account the employer's duty also under the Occupational Health and Safety Act to take reasonable precautions to protect workers from the risk of interacting with unmasked individuals during the COVID pandemic. As more of the population is vaccinated, the urgency of providing such protection will probably diminish. In the meantime, it is important to provide protection for your employers to make sure that if they cannot wear a mask, they either work from home or we have alternate PPE available that is comparable to wearing a mask. When it comes to a customer, it's okay to decline the customer access to the facility and offer them an alternate way to be able to purchase. So masking is an issue that has been puzzling. I think in terms of accommodation, one of the important things is continue to follow your accommodation policy for masking and PPE. Does the employee have a verified disability that requires them to not wear a mask? We have found and have supported many employees who have indicated up front that they have difficulty in wearing a mask, but have clarified that in fact, wearing a mask is something that is possible if we have done like a bit of an exposure program, if it's related to anxiety, that we can help employees to be able to learn to wear that mask and be able to support them through that process. So the next condition or concern that we've seen with the pandemic is long hauler syndrome. And many of you may not have heard of long hauler syndrome yet, but this is prolonged recovery from COVID. So, post acute COVID 19, it's defined as persistent symptoms or a delayed or long term complications beyond 4 weeks from the onset of symptoms. So we are starting to see and hear through our work fitness parent roundtables, through some of the research, that some individuals are having prolonged symptoms or difficulties in recovering from COVID. And it is expected, according to Anthony Karmaroff, who is a professor of medicine at Harvard Medical School and editor-in-chief of the Harvard Health Letter, that we can expect up to 20 million cases of long COVID globally in the next year, and that they may be similar to other post-viral syndromes like myalgic encephalomyelitis, formerly called CFS or chronic fatigue syndrome. And this prediction is based on the prevalence of COVID globally and 10% of COVID cases becoming part of that long hauler syndrome. So some people, 95% of people have indicated that they've recovered from after 2 months from COVID. Well, 10% may have taken up to 9 months, and some have continued to have ongoing symptoms similar to myalgic encephalomyelitis. So what are some of the common symptoms that you might have if somebody has had COVID and they continue to have symptoms past the normal healing time? You might see individuals that are having fatigue, shortness of breath, joint pain, chest pain. You might also see cognitive dysfunction, brain fog, depression, anxiety, muscle pain, headaches, fevers. And less frequently, you might have other parts of our system, cardiovascular, respiratory, renal, dermatological, and neurological symptoms that remain. Because COVID affects the whole body, that viral load, many patients have continued to have long hauler syndrome. One of the controversy and one of the conversations is it partly that individuals are deconditioned from being off work? Are people reporting depression or anxiety prior to the COVID diagnosis? And so there might be a neuropsychiatric vulnerability to some people developing long haul COVID-19. Approximately 70% of the long haul patients were women and 16 had pre-existing autoimmune disorders. So you can see in this picture and also in our blog from this week, just some of the ongoing symptoms and the different parts of our systems that may be infected by COVID-19. And therefore, you might be seeing some employees that are continuing to have some challenges after they've come back to work. A large group of people who self-identify with long COVID includes at least 3 different subgroups. One that are simply going slow recoveries because their tissues were so severely damaged by being in hospital. Another that are less severe, that probably have some residual biological dysfunction in their organs or body symptoms, and that over time they will improve with the proper treatment. And then the last subgroup that have persistent somatic symptoms and dysfunctional behavioral responses as a result of the trauma in this pandemic period. So there's a number of different reasons, and we want to be careful that we aren't creating an iatrogenic population of concerns where individuals have not received the right reactivation. So what can we do to reduce the onset or the length of the condition? We can ensure that there's proper follow-up with their medical specialists for those that continue to take time to recover. We also have seen the importance of cognitive behavioral therapy to manage some of that trauma, some of that anxiety, and supporting employees to get back into activity, gradual reintroduction, and reducing anxiety through getting back into regular activity. Getting that physical endurance, cognitive endurance, emotional endurance back into work. In individuals that are showing cognitive challenges that are impacting the job, we recommend things like functional cognitive assessments for strategies to support some temporary work accommodations and potentially more permanent work accommodations. But as an employer, you want to make sure you're offering work adjustments temporarily and gradually encouraging people to return to work or stay at work through the process to help them to re-engage. Similar to what we've seen in other conditions that have impacted people's ability to be active, this is important also with COVID to get back in the game of life and back into activity on a gradual basis with the right supports. When we talk about other COVID symptoms, conditions or pandemic conditions that are impacting accommodations, there is a constant barrage of questions about, can we ask people to be COVID tested? Or can we ask people to be vaccinated? Now, we are not medical specialists, and so our organization focuses on the functional ability in terms of return to work. But where individuals are going into work locations where there are at-risk populations, it appears that the courts, the arbitrators, are supporting testing to be able to be done regularly for people that are working in long-term care facilities, in hospital, in healthcare environments. And if someone does not agree to mandatory testing, there may be ways to accommodate that mandatory testing, but it may involve taking a look at short-term accommodations in alternate work that doesn't expose them to those people that are at risk. In terms of mandatory vaccinations, we also don't know what the laws will tell us. But again, we suspect that it will be similar to the testing issues. That depending on the work activities that the individual does, if they are exposed to populations that are at risk, like in long-term care facilities, healthcare facilities, direct interaction with customers, you may not be able to make vaccinations mandatory, but you may have to consider other accommodations for individuals who choose not to vaccinate. Some of the interesting things that we've been watching as we hear the laws and the regulations coming through, the decisions coming through, are the questions about things like, can we separate those employees who vaccinate and those who don't? Interesting. I don't know the answer to that, but I would suggest that there's probably going to be some arbitrations around separating people out. You can, in fact, probably ask individuals to take extra precautions or to even work from home if they choose not to vaccinate. So depending on your work activities, there may be ways that you can accommodate those individuals who choose not to vaccinate when that gets to that point. But again, anything mandatory requires an individual consideration when it comes to accommodation, considering what the person's abilities are, what their protected status is, as well as what it is that they're going to be able to do in the job and what their job requires. So making those connections is important when you're looking at accommodations. So I don't have a lot of arbitrations around vaccinations, but watch for those because I'm sure that they will be coming forward. The other issue around pandemic that we want to look at is accommodations and work from home. What we're seeing as an organization is work from home has done a couple of things. One, sometimes it's good and sometimes it has been bad for individuals who require accommodation. But as an employer, you want to make sure that you have a solid work from home policy first. Because what we do know is from an occupational health and safety perspective, you're required to be able to have health and safety considerations in that environment where your employee is working. So, considerations for ergonomics, for their health and safety of their environment, the safety and security of data, all of that has been well documented to be within the employer's responsibility if you're asking someone to work from home. We've also looked at accommodations around family obligations, and this week has brought that back for sure as schools have now closed again, that we have a number of individuals who have responsibility for their children, and their children are now at home again with them. And so, do you have to accommodate as an employer? What is clear is you need to ensure that you have a process to consider someone's need for accommodation around family obligations. So, just as with accommodations in terms of disability, the employee needs to demonstrate that they are responsible for those individuals and there's not that they have investigated other options for care or caregiving for those individuals before you look at accommodation. You want to take a look at, is there a way to be able to continue to have this person do the essential duties of their job while they're meeting their family obligations? Or will there be a need for them to be home under a protected leave under the pandemic, the infectious control protected leave? The other issues that we've seen around work from home and accommodation is the concerns around mental health, around domestic violence and substance use. So, those additional concerns that have come forward with accommodations, because individuals are now working from a home environment that may not be conducive for health and productivity for a number of reasons, or individuals are struggling with their mental health. Now, in part two, we will spend a lot of that session talking about mental health and what kind of accommodations we can do around that. But one of the things that you want to consider as an employer is, how do you monitor for someone's change in behavior or performance that may be related to mental health? How do you protect someone who may be in a situation where domestic violence or other issues may be impeding them? So, from an accommodation perspective, we have assisted many employers in being able to look at their work from home policy, their process, and being able to look at what kinds of adjustments and accommodations might be helpful. And the final one that you're going to consider is options when you call someone back to the workplace. The law has been very clear that as an employer, when this pandemic is over, when vaccinations have happened, when you request someone to come back into the workplace, the question will be, what will happen when someone says, I want to be accommodated still to work from home? As an employer, you have a right to request them to come back into the workplace. You want to be careful about leaving someone working from home and other people coming back into the workplace without a clear process for determining accommodation. So when calling someone back into the workplace, you want to be clear that it's safe, that they have the right setting, the right approach, that they're able to come back into the workplace. And if someone refuses, then as an employer, considering if there's an accommodation need because of family, because of disability, that you clearly go through your process of determining what is appropriate for this individual in terms of working from home. The Guidelines we've been reading have been very clear that when you request somebody coming back into the workplace and they hum, they haw, you haven't made a decision, and they continue to work from home, that there may be an ongoing obligation for you to allow them to work from home. So be clear as you're going back into the workplace with what is your policy when we're cleared to come back in. And will there be hybrid work approaches? And what we've found is some people have been extremely productive outside of the office and have thrived. So, will you be considering mobile work, work anywhere? One of the considerations for accommodation is where does the person live? So, if they have chosen to move to a different province, then the province and where they work become the laws that apply. If they chose to go to the Caribbean, Barbados, Bali to be able to work, then the laws within the country that they've moved to will apply to your accommodation policy. So you want to be clear on what is your process in terms of where someone works and what you will do around accommodation. One of the things we've seen with individuals who require accommodation is, do they have the right technology to support some of the strategies that used to work in the workplace? So many people are working from laptops. Do they have the right chairs, the ergonomics? Do they have the right bandwidth to be able to help with some of the software that they might have used in the past? Understand that these are all needing to be considered if you're looking at a hybrid work approach, as well as accommodations in the workplace. Who owns your health and safety? You as an employer own the health and safety, and so you want to be able to make sure you have a policy for health and safety in work from home or work anywhere, mobile work environments. You want to consider the ergonomics. Who pays for the equipment? Who owns the equipment? How will you assist someone in having the right setup to be successful? And how will you manage productivity? There was an interesting session that I went to just a couple of weeks ago that talked about, can we monitor when somebody is on the computer and when they're not? Do you want to? Let's look at how do we manage productivity now, and looking at managing production, not time at the computer. And looking very clearly at what are the cognitive demands of the job? What are the things that can help this individual to be successful and productive in wherever they're working? The other thing we've seen is very much a Zoom fatigue. Zoom fatigue is very clearly documented as cognitive challenges and fatigue related to ongoing repetitive activity with use of technology. Our employees are experiencing that fatigue, that distractibility, loss of productivity, and loss of engagement with the team. So we want to consider what are some of the things that we can do to help Zoom fatigue. Some strategies that many organizations have used around accommodating Zoom fatigue is things like limiting meeting times, alternating meetings online with other activities, building in micro breaks, allowing them to turn off the video and not being on all the time. And some of the learning and productivity literature that we've read is that someone being on a learning experience or on a Zoom technology experience throughout the day, that the maximum number of hours with optimum productivity is about 3 hours per day on screen. Now, why is this any different than when we were working from the office? because we got up and we got a water. We got up and said a hello to a colleague. We collaborated. We went to different meetings. And so it is important to ensure that we're building in those strategies and tools to help people to have the breaks and the alternate activity throughout the process. When you have a challenging accommodation situation, you first want to make sure you have a good accommodation policy. And through that policy, you may need to engage accommodation experts and third-party assessments. A workplace accommodation assessment allows you to be able to engage a third party to objectively assess the employee's functional abilities and job demands, including interviews with the manager, employee, observation, functional testing, standardized testing, and reviewing the work environment. From that assessment, gaps are going to be determined between persons' functional abilities and the demands of their role. From that, we'll be able to determine what is the length of time someone might need accommodation. Is it permanent? Is it temporary? And make some recommendations for accommodation strategies to enable the employee to perform the essential duties of the role. This third-party comprehensive assessment gives you the tools that you need to show reasonable accommodation. Our occupational therapists are regulated health professionals with the ability to understand the health condition, workplace demands in the context of the work environment, and determine tools and strategies to support function in the job. And we have occupational therapists across Canada that can support your employees in having the right success and accommodations that they need. Now, the other thing before we go to question and answer is to be able to take a look at a new CSA standard that has come out, the Work Disability Management Systems Standards. These CSA standards were developed by a technological team with CSA and were released in 2020. And they help you as an organization to be able to ensure you have the framework for a good work disability management system. It follows that plan, do, check, act process, but it includes creating that system with key responsibilities, accountability, authority, policies, procedures, reviewing where you're at in terms of gaps and setting some good program objectives, implementing the right programs, both from preventative to accommodation and training, and then monitoring and evaluating your metrics, your data collection, and your auditing of the program. This is a new system that we're happy to be able to look at supporting, that we have a CSA Work Disability System Standard training that we've developed that includes a virtual session on May 12th from 9 to 12 Eastern Standard Time, but also has online modules and tools that provide you with all of the tools that you need to put in a solid work disability system. You can find out more about the standards framework, get the tools that you can use, and sign up at gowantraining.com in our store so that you don't miss out on that opportunity. Now I'm going to open it up for any questions. Is there any questions that you have with respect to what we talked about today, some of the challenges that you are seeing in your organization? And so I'll have Emily unmute your microphone if you'd like to see, or is there any, you can put a question in the chat box if you'd like with respect to what are the challenges you're seeing around accommodation. Are there any questions there, Emily, that people have brought forward? I see a hand up with Lisa. Do you have a chat? Do you want to ask a question, Lisa Weiler Haskins? I'll have to unmute her. Okay. Lisa, any questions that you might have?
Hi, Nancy. Thanks for taking my question.
No problem.
So last year, when we went into a shutdown, we had members who couldn't wear masks. They had medical reason why they couldn't. And unfortunately, in a school board, that is a PPE requirement. And so they couldn't wear masks. But then the schools went into shutdown and nobody was at work. So those members then said, hey, I can be accommodated at home like everybody else. But there was this reluctance that, no, you need to be able to perform the job as if you were here. Now, again, that's last year, things have changed, but we're running into that situation now. And I'm just wondering if a member is on a mask accommodation, they're accessing sick leave because there are no jobs for our group online, but now there is. Now they are going to accommodate, they're going to put our members to work online. So with those people who weren't being accommodated at home, do you think that that's now something we can advocate for, saying, you know, it is a shutdown and whatever, and we have a lot of people online. Hopefully that made sense. That was a lot of information, but do you understand what I'm asking, Nancy?
Absolutely. I'm going to mute you as I answer, but I'll unmute you in a second. Okay, so what you're bringing forward, Lisa, is that ongoing adjustment of requirement for accommodation. So depending on the policy of your organization, that employee has a right at any time to come forward and ask for accommodation to be considered. Just because that couldn't be accommodated a year ago does not mean that that employee can't come forward now and say, I know that I have the ability to do the job and I would like to be accommodated on that job. Now you'll hear in part 3 where we talk about that the job has to be open and available and they can't displace someone. So depending on where that individual is at in terms of accommodation and what positions are available. Now, obviously, I believe you're in a union, and so you would know like the rights around seniority and those kinds of things. But the duty to accommodate doesn't include displacing someone else. And so I would expect that they've filled positions, and whether those positions are available, that would be your discussion on rights to bump someone, those kinds of things in order to be accommodated. That would be part of what your collective agreement and your discussion might be with the employer if that position is no longer available. Does that make sense?
Yes, yes. So I think it is worth it bringing it up again with the employer. Thanks so much, Nancy.
It absolutely is always worth bringing it up, because as the system and the process and even the laws change, whether an employer can accommodate or not is going to change according to what's available, what's happening, what the laws say, what PPE is available, what technology is available. We've had individuals who couldn't be accommodated in the past, but we have new technology that's now available. Bringing that forward allows them to be able to be accommodated in the workplace. And so that it always starts with the request to the employer, and then the employer owns that accommodation process and is required to go through that in a set way according to their policy and their procedures. Okay. Is there other questions? Okay. All right, we've got a few questions now. So So, recently asked about ergonomic setup at home. What is your suggestion to tackle this? So, in terms of ergonomic setup at home, many employers, because of the work from home situation being considered temporary, have set up work from home temporary policies. I would suggest that you want to work with the employer to be able to set up a work from home policy, whether it is temporary or permanent. What equipment do they get to take from the workplace? Who owns that equipment? Some organizations have set up a stipend of $400 towards ergonomic work from home, but that's all in a work from home policy. So, my suggestion to tackle this is to say this is an occupational health and safety requirement. My employee appears like you're continuing to have them work from home. As an employee, I require this. What is the work from home policy on that? It is the employer's right to be able to say, we do not pay for any equipment, but then we also need to consider health and safety. So if someone does, though, have an accommodation need, that may be a different policy under the accommodation where the ergonomic setup might be covered. Okay. Thanks, Cindy. Kathy has asked, we have let employees take their office setup homes and we track the equipment that they've taken. This has helped a lot as they can have their ergo chairs, sit and stand desks, etc. Again, great strategy, Kathy. If the employee can take what they've had at the office into their home office, the main thing is tracking who owns, who's responsible for maintenance of that, and the return of that when we return to the office. So making sure that that's considered in your policy is really important. Hector, I think it's Hector. I have a question. As an employer, how can we accommodate employees requesting medical accommodations of avoiding areas of work with a perceived higher risk of contracting COVID-19? So let's go back to our accommodation steps. The employee has requested a medical accommodation. So with that, we want to make sure that that individual, in fact, has a protected area for which they are covered. So do they have a disability? Do they have a family obligation where they may be accessing elderly people with lower immune systems? So that process of determining and verifying the accommodation need is your very first that you want to consider. Is you want to consider what is the accommodation requirement and why, and is that protected under the jurisdiction with which they work in or through your policies and procedures. In terms of only working in areas where there's perceived higher risk of contracting COVID-19, my suggestion would be looking at what are your health and safety requirements? What are your PPE? Is it a perceived higher risk or a true higher risk? So we always want to be objective in our process of accommodation. We want to make sure that we've looked at, is it a truly quantified higher risk of contracting COVID-19? So what are we doing about that? How are we mitigating that for all of our employees? Because we don't want any employee with COVID-19. But we also want to make sure if the person might have a disability that causes them to have a higher risk if they do get COVID-19. So immune deficiencies, several different types of conditions. So you want to include a good review with the healthcare provider about what is the protected area, what is the risks that this person holds. I hope that helps. Treatment is an accommodation challenge, i.e. COVID treatment involves rest breaks, reduced work hours, and reduced stimuli. So Angela, I'm not sure that I fully understand that question. So one of the things that I would say is going back to your accommodation process and say, what is the person able to do? And what is the demands of the job? And then being able to to say, can I adjust and accommodate it so that the person can do the essential duties of the job? So rest breaks, reduced work hours, reduced stimuli may be what's being asked for, but we also want to take a look at, is there other strategies that allow this individual to do the essential duties of the job? When we get to that point where we've looked at all accommodations and the person is still not able to do the essential duties of the job, it is up to the employer to determine if that's reasonable accommodation for them. Does that present as undue hardship? Is it temporary? Is it permanent? So again, going through those processes and steps is really important. And in part 3, we'll walk you through step by step how to determine if someone has met their accommodation challenge. We know that right now we're trying to be really compassionate and give as much leeway as possible, but we also may be getting into a situation where this type of work is going to be required in the long haul. So we want to be looking at permanent accommodations that make sense to allow the employee to do the essential duties of the job. Kathy has asked, we do have telecommuting policies. They sign a telework agreement as well as completing hazards assessment for work from home. That's great, Kathy. That's a wonderful process. So it is important if you are going to have people do hybrid work or work from home, and now we're into a year later, you want to be able to have a process in place to say this is a temporary agreement because of the pandemic, or this is an accommodation agreement, and completing those hazard assessments. So great, Kathy, that's wonderful. Is there templates for work from home? Those are some of the templates and the tools that we can share with you in our training program that we're doing on the CSA Work Disability Policy and Process Systems. That's included in some of those tools that you would be able to get as part of that training. So we'd be happy to have you join us for that and get those templates and policies. If you would like some, we can also, of course, do some consulting to support your policy for work from home if we can be of assistance. Is there any other questions? I think we've come to the end of our time and the end of our questions. I really want to thank you all for spending so much time with us today. That we would love to talk to you about our accommodation questions. Here's some information about how to get in touch with us. But don't forget to join us in part 2. So part 2, we're going to talk really specifically about mental health, about episodic and chronic conditions, and some of the changes in work into the future. And so we're hopeful that you can join us next Thursday, same time, same place. And you will be receiving in your inbox a certificate for attending the session that you'll be able to download if any of you are CDMP, return to work specialists, whatever you need for your CE credits, that will be coming to you in an email. Watch for that. And we will see you next Thursday. Thanks again for joining us. And it's lovely to see you here. Talk to you soon. Thanks.